Ignoring getting referrals from medical doctors is costing you more than you think. Think about the different avenues you've been trying to be attracting new patients or clients, whether it's posting on social media, networking, thinking about spending money on ads or on SEO or other avenues. It can either feel really time consuming or money's going out the door. Even if ads are working well for you, it's like money going out the door every single week, every single month. And if you stop spending money on it, then what happens with the lead flow in your practice? That money you might be spending on ads or other avenues, you could put that right back in your pocket. Whether it is a few $100s a month, whether it's $500 a month, whether it's $1,000 a month, like let's put that back in your pocket. When a person is referred by their doctor, patients pay attention to that a lot more because their doctor is saying, go see this person. So it's so much better than you trying to convince people or you trying to help them become more educated about how you could help. Like there's already a credibility factor there because the doctor's referring. The other thing that's nice too is those of you who have associates in your practice, this can also be a great avenue to fill up your associates practices too. So imagine having your associates have a fuller practice, a fuller schedule. They'll be happier. And then you're going to be happier too, because it will also help more patients beyond the amount of people you could see yourself. And then money is coming in the door without you having to be there too. So getting medical doctors referrals going can be so great, especially if you have associates too. Getting referrals from medical doctors is one of the few avenues where you could put it in place once, and then you don't have to always be constantly marketing because they could be sending you referrals even 3 months from now or a year from now. And imagine if you just had 3 providers sending you 1 or 2 referrals a week. What would that do for your practice? You might feel intimidated or you might be interested, but then you don't really know how to get it going, so that how best to approach them so that they start referring. Also, you might feel like, well, it seems like it's a lot of work to reach out to the doctors and trying to get their attention. And the truth is that it doesn't require a lot of work if you know what you're doing. It just requires being more effective with what you're doing and be more strategic. I would say that it's not about having to send like 100 letters to doctors in the areas. It's also not about having to constantly bug doctors or anything like that. It's really about having a good approach with a handful of doctors. You don't need that many people referring. You just need a handful of people who are your biggest champions. I actually have heard a chiropractic practice management company recommend like writing down a list of 100 doctors and then reaching out to them. And they're all about, oh, it's a numbers game. It's a numbers game. And I think, oh my gosh, it just sounds so exhausting. And so, especially for us introverts, that can feel really draining and exhausting. It doesn't have to be hard. There are ways to speed up getting doctor referral. There are 2 avenues that we could help you with getting referrals coming in the door from medical doctors and other kinds of practitioners. And remember, they could be either conventional practitioners or they could be holistic practitioners referring you people too. There are a lot of misconceptions that medical doctors have about integrative options and holistic options. And a lot of it is because that they weren't really trained on this. And so when they aren't trained on it, then they just are concerned about recommending it or letting people know about it because they don't really know much about it. Also, if they're concerned about safety and efficacy, then they're not going to refer. So it's really up to us to educate those providers, because otherwise they're going to go around and continue to have these misconceptions, which are often in like not really true. And so it's not because they became medical doctors to be closed-minded. I mean, they also want to help their patients too. It's just because of the nature of what they're trained in and the nature of what they understand that they are in a place where they may not really understand. And so certainly there are doctors in different spectrums related to that. Some are like very skeptical and some are very open. And then some are open, but they're, they don't really understand very much. So it's these doctors here who are open, and then these doctors here who are very open, and then also those who are open, who are the best to be getting referrals from. And I know that when I've practiced in a conventional medical world, there are people like me who are like, secretly into holistic options. And then we never really talked about it at work or anything because we didn't want our colleagues to think that, something was wrong with us. But I promise you, there are people like that out there, and just like me, because I met more of them as I continued to practice, like more conventional medical providers who felt that way, and also other kinds of supportive providers, whether they're pharmacists who don't like recommending medications actually, and then there are also nurse practitioners, and other kinds of holistic health other kinds of health practitioners out there who really don't like prescribing drugs as first line. And so there are enough of us out there in your city, in your town, to be referring to you. You just need to know who best to get through to, and then how best to approach them so that they start sending you referrals. And this is something that we help our clients with. And I'm just super excited to help you with this, especially coming from my experience of having been in different settings, working in the hospital setting and outpatient setting, having seen the insides of the FDA and at Merck, and seeing what gets doctors to refer and really being able to give you the shortcut, and seeing what gets doctors to refer and being able to give you the shortcut to that. So super excited to help you with this. There are ways to speed up getting doctor referrals. In fact, that's something that I'm super excited about in a makeover mentorship that's coming up here soon. One avenue we're helping our clients with is by getting one thing dialed in to educate providers on, like, a good angle of a topic to educate the providers on. We found this to be speeding up getting referrals from doctors much more than other avenues, because even if you have a good connection, they might not be sending people to you because they don't really understand the full scope of how you could really help their patients. But then if you are able to educate them more about it, and they also get to see if they resonate with you, they're much more likely to refer. So what we look at getting in place is just essentially like this. It's like one signature talk that you can give to someone, whether it's one-on-one, via Zoom, in person, in a clinic setting, or it could be in a larger setting as well. So we've had clients who've spoken in front of a larger group of providers and then getting referrals in that way as well. So there's a range of what you could do with it. And we just need to get that one thing dialed in. And then so that's the first step. The second step is then to get you opportunities, so in front of providers. And then the third step is then having that opportunity translate into new patients and referrals coming in the door. Because it is one thing for the doctors to know about you, and it's another for them to start referring to you. So what to actually say and what to have that would support them sending you referrals sooner rather than later. And then once you start getting your first referrals, then having a system in place that supports ongoing referrals. So we're helping our clients with this in this upcoming cohort. I'm so excited about it. And so it's the 6-figure speaking makeover mentorship for introverts. And you're welcome to click on the link to introvertedvisionary.com, book a free call with us, and then more than happy to see about helping you with getting this off the ground faster, and then getting a repeatable process in place that puts you on the map more as a go-to practitioner in your area for this, and then also be getting provider referrals from it. There's a second avenue in which our clients are coming to us for help with this, which doesn't involve getting a signature talk in place. So it's for those of you who are, and you don't have an interest in educating to the providers in that kind of a way, then there is still possible to be getting referrals from doctors. It's just that the first avenue that I shared with you will speed up getting referrals even faster. But the second avenue could also be really effective. And it's really helping you through the 5 steps of the consistent patients formula for introverts, of which this is the third step, getting the phone ring step. This is one of the 2 strategies in the third step of getting the phone ring more. And it's perfect for you if you are making between 5K and 20K months right now. And that's like the sweet spot for this. And then we've had clients experience growth with it, and also more provider referrals from this. So it's actually, we're continuing to add to it, and also anything we have done for you, templates and scripts that are working for our clients, we give it to you so you're not having to reinvent the wheel. And then I really getting these key steps in place in your practice, because there are also other steps that can help support the practice become more consistent. So whether it has to do with the other getting the phone ring strategy, or it has to do with what happens if when people end up becoming a patient of yours, do they stick with care, or do they drop off before they get care, or how are things going with going from inquiries to actually booked appointments and patients? So, and for those of you who offer things like packages or programs or group programs or automated online course, how can you be ending up having more people sign up for those? So helping you with that in the 5 steps of the consistent patients formula for Introvert. So that's a second way to get help with this. One of those 2 options could be great for you to get help with this and getting it in place in your practice. And, one of the things is, if you're not the ones educating the providers, who will be? And there are a lot of misconceptions out there about what you could really be, like the scope of the different kinds of things you could really help people with. And so if not you, who? It's up to us to collectively educate more medical doctors and other conventional medical practitioners so that they understand about integrative options. The reason why they are not yet referring is just because they don't understand it very well. And so if you are able to educate them more about it, there are medical doctors who are open to referring. So not everybody is going to be open to referring, but some are. And then the ones who are, I'm going to help you with reaching out to them and then getting that going so that you start having referrals come in, from doctors. So you can go to introvertedvisionary.com, book a free call with us, and more than happy to see how we can help you grow to have a practice that's fulfilling and a wonderful flow of patients or clients coming in the door and the introverted way. So see you soon. Look forward to helping you.